Hi guys, my name is Ashlyn, and today I'm going to be talking to you about my project. So my client is a 21-year-old female who used to exercise regularly and participated in dance and cheer in high school. And when she got to college, she kind of quit. She is still active and does cardio workouts at the gym regularly, but that's about it. And she's noticed a little bit of weight gain in her abdominal area. So she wants to try and strengthen her core and get to a healthy weight. So her SMART goal is going to be to improve overall core strength within an 8-week plan by performing 45-degree decline sit-ups. So a SMART goal is typically split up into 5 different sections, which are specific, measurable, obtainable, relevant, and time-bound. My client's specific goal was to gain muscle in the rectus abdominis and external obliques to perform 45-degree sit-ups consecutively in an 8-week time frame. So her measurable goal would be to start the first week with a 10-degree sit-up and increase by 5 degrees every week until she is able to perform a full 45-degree sit-up at the end of her 8-week plan. The obtainable would be an elevation of decline should gradually increase each week to build stamina. Relevant would be she wants to increase her body positivity, be more confident in her own skin, and look healthier. And time-bound would be that she wants to obtain her goal within the 8-week time frame and be able to perform consecutive decline sit-ups. Now, before a exercise program should be performed, you have to give your client a PARQ or a physical activity readiness questionnaire, and that will tell you if the client has any health risks that could further injure the client. So if you say no to all 7 questions, normally there are 7 questions, there could be less and there could be more, but if she says no to all of them, then she is okay to proceed in your exercise program. And if she says yes to one or more of the questions, you should talk to the doctor by phone or in person before continuing with any other exercise program. And my client did take her PARQ before, and she did answer no to every single question, all 7 of them. For our first step in our exercise program, we're going to start with a spinal twist, and that's where you rotate your spine and stretch the muscles of the back, and it helps restore and retain the spine's natural range of motion so we don't injure the client. This next activity is going to be the pelvic tilts progressions modified dead bug with reverse bent knee marches. And in this exercise, you're going to improve hip mobility in the sagittal plane without compromising the lumbar stability during low extremity movements. And our client, she's going to be doing 10 reps in 3 sets with 30-second stops in between. Next exercise my client's going to be doing is the thoracic spine or T-spine mobilization exercise, spinal extension and spinal twist, and this is to promote thoracic extension and help with the spine's range of motion just like the other one, and stretch the muscles of the back and twist rotation in the spine. And she is going to be doing 8 reps and 3 sets of this exercise. Next exercise my client's going to be doing is the decline sit-ups, and we're going to be starting at 10 degrees, and then for every time she comes in, she's going to go up 1 or 2 degrees depending on how she feels that day, and that's going to be with all the other exercises as well. So we'll switch between higher reps or higher or lower sets depending on how she is doing. Also, we're going to do, for the decline setup, we're going to be doing 12 reps of 2 sets for starting. And the last one that we're going to be doing is the hip mobilization, spinal 90-90 hip rotator stretches. And these are to improve hip mobility in the transverse plane. And we are going to be doing 8 reps and 3 sets of these. And we're also going to be switching the reps every single time she comes in. That is going to be our last exercise of this exercise program.